Under scrutiny for its response to COVID-19, the World Health Organization is promising an independent review of how it handled the outbreak. Here's the chief of the WHO speaking earlier.
WHO is committed to transparency, accountability, and continuous improvement. For us, change is a constant. I will initiate an independent evaluation at the earliest appropriate moment to review experience gained and lessons learned, and to make recommendations to improve national and global pandemic preparedness and response.
China was initially opposed to a review of the virus's origin and spread, but today the president of that country said he would support an impartial investigation, as he called it, once the pandemic is under control. China is also committing $2 billion to help developing countries combat COVID-19. So how is Canada planning to help more vulnerable regions like Africa? And how will Canada be involved in this COVID-19 review? Karina Gould is the Minister of International Development. Hi, Minister. Good to see you again.
Good to see you too.
Thanks for being with us. Last week, the UN released results of a study that projected AIDS deaths could double in sub-Saharan Africa due to COVID-19, just because of the disruption that it may cause in hospital services. I think the amount of time it was projecting was for about 6 months. Are you concerned about that? And if so, what is this country prepared to do in response?
Well, absolutely. I mean, one of my top concerns, Vashi, is the collateral damage or the side impacts of COVID-19 and on essential health services and on other diseases. And so Canada has been very committed and steadfast in maintaining our existing international development and humanitarian activities. And part of that was announcing last week our contribution to Gavi, the Global Vaccine Alliance, and the Global Polio Eradication Initiative, to make sure that while we are absolutely responding to the COVID-19 emergency, that we continue on with the really important life-saving health interventions that we do on a day-to-day basis every year. And of course, responding to HIV/AIDS, but also malaria, tuberculosis, providing sexual and reproductive health services, as well as maternal and newborn and child services, is incredibly important to make sure that to the extent possible, we continue to provide those health services in the developing world, even as we face COVID-19.
So just so that I'm clear, you're saying that this country will maintain its assistance, its international aid funding that is directed at all those things you talked about, but in addition has pledged more money specifically at helping the vaccine. And my understanding is also that you announced $159 million in international aid at the start of the pandemic, but you also said it was just a start. So is there more coming?
Yeah, that's correct, Vashi. So I announced on April 5th $159.5 million, which went to CEPI, which is the Coalition for Epidemic Preparedness Innovation, which is the global coordinating body with regards to vaccine development and research. It also went to specific humanitarian assistance in response to the UN's humanitarian calls, so providing water and sanitation, hand washing facilities in some of the hardest to reach places and refugee camps, making sure that frontline humanitarian and healthcare workers and some of these most vulnerable and marginalized populations have PPE, and really ensuring that, we continue to support the logistics and the food security infrastructure on the front lines as well. And so that is in addition to our normal humanitarian and development activities. And we're continuously reviewing the new UN appeals, the new WHO appeals, to see where Canada can continue to respond. And I'll hopefully have more to say in the near term on that.
Yeah, I do want to ask you a bit more specifically on that for a couple of reasons. First of all, the UN increased its global appeal to fight the pandemic from $2 billion. I'm sure you're well familiar with this, but for our audience as well, $2 billion US to $6.7 billion. US. There is also, we talked to Stephen Lewis, for example, last week, who's well known in this country as a former UN Special Envoy for HIV/AIDS, and he was critical of overall the level of international aid in this country. I take your point on the commitments that you're maintaining, but your government during the campaign, the Liberals promised, for example, to increase it every year until 2030. We know we're not at the target of 0.7% of GNI right now.
Look, I mean, one of the things that keeps me up at night right now is the collateral damage with regards to COVID-19. David Beasley, the head of the World Food Program, when he was briefing the UN Security Council over a month ago, talked about multiple famines of biblical proportions. And in the conversations and the information that I'm gathering from partners in developing countries, from humanitarian actors, is that, when it comes to food security, when it comes to that basic health infrastructure, when it comes to income security in the developing world, we are facing a huge crisis on the horizon. And, Canada is responding. We've been playing a really positive, constructive role in the multilateral sphere. We're also engaging with partner countries to make sure that we continue to rally that support. And, as I said, that initial response was in addition to what we normally do. And we will be there to make sure that we respond to try to mitigate, these really huge challenges that the developing world is facing, particularly in some of the most marginalized and poorest areas of the world.
Is there a more specific timeline to when you and your colleagues in the government might be announcing whether and how much more you're prepared to commit to that? And I ask again specifically, Mr. Lewis was critical, that Canada is not leading when it could be.
Well, I would push back against that because we were one of the first to respond to the UN appeal. When it came to the announcement, last week with regards to Gavi and polio, Canada again is leading. We are stepping up. And the other important place that we are leading in is really trying to maintain that focus on existing development and humanitarian challenges. A number of countries are pivoting their assistance away from those core activities to the COVID response. And we recognize that we need to do both because, as we see those pre-existing challenges, they don't go away because of COVID-19. In actual fact, they're exacerbated even further. And so when we think about, the most marginalized and the poorest in the world, we're talking about a doubling of people who live in extreme poverty. We're talking about a doubling of people who are facing acute malnutrition and food insecurity. When it comes to rising violence against women, when it comes to accessing sexual and reproductive health services, these are things that, were a challenge before and they're only exacerbated now. And so what I've been doing is really, pushing colleagues around the world to stay the course as much as possible to continue to provide these life-saving interventions in addition to what we do. We also recognize that this has to be a global response and we have to work through the multilateral system. And we've been a really strong voice on the international stage to make sure that we continue to work together, that we're coordinated and that we're collaborating. I'm co-leading with the UK right now an informal meeting of development ministers to come together to talk about how we can have a coordinated and a collaborative international response, which is so important to be able to address this global issue.
Yeah, I take your point on the need for collaboration and coordination and that some countries are pivoting away from development. I'd point to south of the border, but I would also add that the EU, for example, has redirected $20 billion towards aid and all the things that you just laid out. I do have to switch subjects, though, before I let you go, and I wanted to ask you about an announcement from the World Health Organization today in which the head of the WHO promised to conduct a review into its sort of own behavior during all of this and the questions around China. Last week, Deputy Prime Minister Chrystia Freeland said you had a conversation with him and you raised the prospect of the review. Can you tell us exactly what you told him Canada's position on that is?
Yeah, sure. So, I've been engaging with most of the heads of international agencies, including Dr. Tedros of the WHO. And what I said was Canada is very supportive of the work that the WHO is doing and has been doing and understands the need for a multilateral approach to this global issue, but that we do expect there to be an after the event review to make sure that we learn the lessons of the response and have a clear understanding of how decisions were made and what the impacts of those decisions were. And he was very open and appreciative of that. And we had a very good and frank conversation. And I would say that, Canada has been very clear, the Prime Minister has been very clear that right now is not the time to do the review while we're in, the midst of the pandemic and the midst of the response. But after the fact that we need to have a very thorough examination of the actions and decisions that were taken, to understand how we can improve upon that in the future and what lessons we can learn to ensure that we can prepare for the next pandemic when and should it occur.
From your perspective, Minister, what does after the fact mean once there's a vaccine?
Oh, no. I mean, I think it means once we think we have a greater sense of control of the pandemic, when we're not in the acute emergency and crisis period, we have to recognize, Vashi, that while, in some parts of the Western world, we think we've gotten over the initial spike in cases, what we project in the developing world is that we're just at the beginning of the outbreak. And so we're not through this crisis yet. And I think once we see the number of cases start to significantly decrease worldwide, that's when we can start to turn our attention to, how the response went and the after effect. But we're really not there right now because we're still very much in the midst of the crisis and in the midst of the immediate response.
I know you said the Prime Minister, from your perspective, has been clear on the need for these questions to be answered after and not right now. His critics say, though, in the opposition, that he has not been clear and your government has not been clear enough about the behavior of China at the outset of this pandemic or at the outset of the outbreak and the WHO's reliance on information and data from China and Canada's subsequent reliance on the data from the WHO. Do you yourself specifically have concerns about the degree to which the WHO relied on Chinese information and data early on?
Well, I think we have to understand and appreciate that the WHO is reliant on all of its member states to provide information, just as we as a federal government are reliant on all the provinces and territories to provide data. And so each member state collects data in a different way. And so, that's one of the challenges of the multilateral system and the limitations of the multilateral system. However, I do think that the WHO did provide, to the best of their ability in as timely a fashion as they could, the most accurate and up-to-date information that they had. I also want to reiterate that, we've only had this virus in our world and interacting with humans for the last 5 months. And so we continue to learn a lot. And we're also seeing different, reactions in different people and different countries. We're learning what those patterns are. I think like anything, when something's new, you don't have a perfect response to it because you're still learning and you're still collecting that information. But I do think that what we have seen is greater collaboration and a recognition of the importance of transparency in providing that data and providing that information. And of course, that's something that Canada has always, regardless of which political party was in the government, has always pushed for, at the WHO or other UN agencies to make sure that we have the best, most accurate, timely information so that we can make appropriate decisions as a global community.
Should they have been more skeptical, though, of what was coming out of China, given the behavior of the government there?
Look, I think that what's really, important to focus on is the fact that, they provided the information as soon as they had it, and that it's been something that, we've all been pushing for and working for. And I think that
China, sorry to interrupt, but China provided that information as soon as they had it? Is that what you mean?
The WHO provided the information to the world as soon as they had it, and they provided the best information that they had access to. And of course, this is based on all different countries, all member states providing the information. But, there's a wide range of capacity across the world in different countries in terms of the information that they can provide. And I think one of the lessons learned and one of the things that we need to take from this is to try to provide a leveling of public health infrastructure throughout the world and making sure that no matter which country it is, every country has access to the tests and the diagnostics that they need so that we can get good and accurate and disaggregated data so that we can make informed decisions to best protect our population.
With respect, that doesn't have anything to do with the question. I'm not talking about China's lack of capacity. They have capacity. They're doing 11 million tests over 10 days in Wuhan alone. The question was whether the WHO should be more skeptical of China given the behavior of that government.
Well, I mean, I'm not sure that that's the place for the WHO, because the WHO is a product of its member states. And I think that each member state can push for openness and for transparency. And, one of the things that we're doing with the World Health Assembly this week is continuing to raise that issue and to push and to make sure that our voice as Canadians is being heard in terms of what we expect other member states to do in terms of providing information and data and shoring up the capacity and the capability of the WHO.
Okay, thank you very much, Minister Gould. Appreciate your time this evening.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.